Hi everyone. We have interpretation services from English to Spanish. Para aquellas personas que desean escuchar esta discusión en español, tenemos el servicio de interpretación disponible en español. Para usarlo, seleccione el icono del mundo en la barra del menú de Zoom y seleccione español. Si alguien está conectado por teléfono, seleccionar los tres puntitos en la parte de abajo y luego seleccionar interpretación de idiomas y español. Hi all. Thanks for joining us today. I'm Daniel Castellanos, Director of Research and Innovation at the Latino Commission on AIDS. Today, we will be talking about the Stronger Together Partnership, or SDP, a collaboration of Black AIDS Institute, San Francisco Community Health Center, and the Latino Commission on AIDS, three organizations led by people of color. These three organizations joined forces last year to address the differential impact of COVID-19 on our nation, and especially on racial and ethnic minorities. Of particular interest was their concerns about the institutional impact of COVID-19 on organizations led by people of color providing HIV, STI, HCV services to racial and ethnic minorities. There was also a concern about the need to strengthen our institutional capacity and infrastructure to continue providing these services and address the emerging COVID-19 related needs among our communities. With the support of many organizations and public health leaders, the Stronger Together Partnership conducted a national rapid assessment on the institutional impact of COVID-19 in the US, Puerto Rico, US Virgin Islands, and affiliated Pacific Island jurisdictions. The partnership also conducted a virtual strategic think tank with 162 community leaders, researchers, policymakers, public health leaders, and providers from 105 different organizations across the US and its territories. These efforts led to the development of a strategic blueprint with research, policy, funding, and practice recommendations that take into consideration health disparities, COVID-19, the census 2020, and the challenges of the US economy. You can find more about SDP and the final reports at the link posted in the chat. Today, we would like to talk about the partnership and about the importance of these community-initiated and community-driven efforts for ensuring our input in public health decisions impacting our communities of color. We would like to ask some questions to the leaders of this partnership to learn more about the challenges and opportunities of their partnership last year and their plans for 2021-2022. Let me welcome Raniyah Copeland, President and CEO of Black AIDS Institute, the nation's only national HIV/AIDS think and do tank focused exclusively on Black people. Toma, CEO, San Francisco Community Health Center, which in 2015 became the newest federally qualified health center in San Francisco in over 40 years. And Guillermo Chacon, President of the Latino Commission on AIDS, and he is also the founder of the National Hispanic Latinx Health Leadership Network. Before we start, if you have any questions, please drop your questions in the Q&A box, and we will discuss them after the panel. Just a reminder to the panelists to speak slower for the interpretation services. To begin, we would like to ask the panel the following question, and anyone can answer it. What are some of the lessons learned regarding conducting people of color community-initiated and driven assessments and virtual think tanks in 2020? Anyone?
I'll start. One of the things that we found that I think was really interesting was how COVID was impacting people of color-led organizations programmatically, but it was also impacting them as individuals because they were people of color. And there weren't really sufficient resources and support for what it meant to be a person of color, being disproportionately impacted by COVID as an individual. So they had family members who were being impacted by COVID, them personally being impacted by COVID, and then being asked to do the work. And we saw an increase in resources to support COVID and COVID testing, but there wasn't the same type of support to really support the infrastructure and the well-being of people of color who were doing the work as it relates to COVID and HIV. And so we saw that as one of a pretty significant gap in support and services to sustain people who are impacted by COVID, who are people of color, who are doing work around HIV and many times COVID as well.
And could you speak a little bit about the coming together, not only these organizations, but all these different organizations across the U.S.?
I could add to that, just to piggyback onto what Raniyah was saying. You know, I do think what the three of us realized when COVID hit is one of the first things is we did come together and check in with each other. And that was so important and powerful to remember that in times of crisis, we are doing so much in our organizations, with our staffs, with our communities, but to reach out to other partner organizations who are going through the same things, it's powerful in that you feel like you're not alone. And we learned this from HIV. Too late, I think, sometimes, that coming together actually allows us to be more powerful. And so after the three of us checked in, you know, it was clear that, oh my goodness, we need to reach out to our peer organizations, our POC organizations in the HIV movement, because we just knew that they were going through what we were going through. And if we could connect with these other organizations, our sense was that it was just going to be helpful to us and helpful to our communities across the country. So that's what we did, and I think that seeded the next steps around the rapid assessment and then the virtual think tank.
Yeah, I will add to that. You know, having Raniyah and Lens, you know, as a small circle of support means the world to the three of us, because as Raniyah and Lens remember, you know, when we start to meet in April, I think last year, it's unbelievable, over a year, we were crystal clear that we need to create that circle of support and circle of coming together with other people of color. Raniyah put it, you know, very clearly that it was not only, you know, the infrastructure, but individual, and also something that for the three of us and many, many other organizations very dear is to honor people of color in leadership positions. Why? Because unfortunately, when you begin to look health in general, you know, we all health indicators are very, very troubled for us. And when you start to look COVID, you know, it was clearly that we will be again heavily impacted. And, you know, it's Native folks, Black folks, you know, Latinos, Latinas, Asians, South Asians, folks in the territories. You know, it's a clear sense of how important was for us to create that space. And I think when we process the idea of a stronger together, it really simple, but it's so powerful. And I'm so honored to get to, you know, advance our relationship, because I always told Raniyah and Lens, you know, it's the level of trust that I feel with the two of them and other fellow people of color is key for me to be crystal clear in my mind how to respond in a more responsible way to the urgent needs of our communities.
Yeah, I want to also go back to a little bit what Raniyah said at the beginning, because I think the teams connect this idea that the institutions were being impacted, but also, as Lance and Guillermo said, the individual people were being impacted, the staff were impacted in the midst of a very complicated year in terms of COVID and Black Lives Matter and all these issues. What are some of the issues of interinstitutional support that you found more helpful? Is that making sense in terms of the coming together and sharing of information and support and resources. What are some of the themes that emerge from coming together?
I mean, what I could share is, we were doing a rapid assessment. We launched that pretty quickly. But what I remember is when we made a call for our national virtual think tank, we weren't sure, how many folks would have the time, amidst this crisis, the pandemic that we were all dealing with. And what we saw was an overwhelming number of folks who were thirsting and needing space to be in community with other POC organizations, folks who some we all knew, some we didn't know, but that we could create space was so powerful, because I do think in the midst, like, we're talking about, of a pandemic, we are all doing what we need to do to take care of our communities, and that's just our number one focus. But to step up and to see that we are connected to so many other organizations, and we can give each other support in this time, so that we're not operating in isolation. That we know will lead to burnout. We know that will lead to, to organizational crisis on some level as well, if we're not sharing resources or pointing to where there are other resources to go to. That's what a collective, movement does. And I know, for me here at San Francisco Community Health Center, we were huddling every day with our staff who were on the ground in the community, working with our communities. And when I could say that, I am in touch with Black AIDS Institute, Latino Commission on AIDS, and we're doing all we can to support each other, that went a long way to my team here on the ground, just knowing that there was a much bigger picture, and we were connected to that collective.
Yep. Anyone would like to add more about those very intimate personal experiences last year?
I think that was, what Lance said was so important. There was also, though, like, Guillermo sent us the different policies that LACOA was utilizing, had developed for, going back, well, not even going back to the office, like working from home virtually, whether they were using Microsoft Teams or using whatever the different kind of electronic software was. And so those real kind of like tactical pieces of information were so useful last year, because we didn't know what other people were doing. And also being able to lean on other organizations that were people of color led, that maybe had more infrastructure, more support, different kind of insight, was really useful, because it really was us making decisions, not because we were able to do a lengthy assessment of best practices or a strategy. It was constant decision making at a rapid and rapid moments, because things were changing so quickly. And so just being able to share policies, talking through the challenges that we were having as a collective was really important. That's what I think the three of us experienced, because as I think three people of color leaders, of national organizations, that we were really committed. And before COVID, we had a partnership in really supporting each other as people of color leaders. And that, when there was funding opportunities, when there was galas, that we were committed to ensuring that we were successful, because we know there's not too many POC-led national organizations. And so that's something that the three of us as organizations have had for years. And that happened when, when COVID happened, it was very natural to say, hey guys, what's going on? What do you have that you can share? Because I don't have a HR person on staff right now, and, LACOA does, or San Francisco Community Health Center does. And so that was really useful. And then taking that to smaller CBOs that were led by people of color across the country, I think was really useful. And so at the think tank, like Lance was saying, we weren't sure if people were going to participate and people were going to have time. And so to see how important it was for people of color led community-based organizations to have this space, I think was so beautiful. And that they, said, we don't have this space regularly. When is it that it's an explicitly POC space for people within the HIV workforce is hugely unique, and that's not something that happens. And being able to share what the challenges were really useful. Hearing the solutions that people were coming up with was really useful. And there's a solidarity that happens when you have that sharing of information. You feel so much stronger. You know that you are in it together. And I think Guillermo came up with the name Stronger Together. And it was really natural because it was literally like, that is what we are doing together. And so it was a great experience to take this very natural relationship that the three of us have as leaders of organizations and translate that to people of color-led organizations across the country. And it really showed how unique that space is, how important and critical that space is as well. That, it was us defining for ourselves what we needed, that as a collective, we were able to say, these are the things that we know are really important to us, being able to have breakout spaces. Hearing from our Indigenous brothers and sisters who are, on the phone, driving through the reservation, being able to talk through the things that they needed. It was so powerful. And I think with COVID, it's been very clear, like, we are going to be in this for a minute. And we know that, like HIV, with COVID, our communities are going to be most impacted. We already knew, and some of the findings from the survey, that rapid assessment, were, concerns around vaccination uptake. This was before we even had vaccines. There was concerns amongst organizations, like, we aren't sure, we don't believe that there's going to be high vaccine uptake in our communities. And so being able to have those conversations and then be able to plan for, and this is what we need, especially in an election year. Now with a new administration, being able to speak for ourselves and say, these are the 10 recommendations that we have as, X number of community-based organizations, I think is really powerful. And now, a year plus into COVID, we now have vaccines. I think there's a real opportunity to think about, like, well, what's next for us? And I'm sure that's probably one of your questions that you have for us. But what's kind of next? And I think that we had such great recommendations from people because we all came together, that we really have a strong framework for, responding to COVID, but also to HIV and to STIs, and how important it is for us to have space for us to connect, space for us to learn from each other, and space for us to collaborate and partner in our shared missions.
I wanna add that, we went deeper in consolidating our trust. That is a very important currency. I always remind people, something hard to build, but sometimes quickly to lose. Also, together, we win, together we win victories for our communities. And also together we were more strategic, as Raniyah and Lens described it. But also we validate our leadership. I always told people, if you're not visible, you're invisible. And a Stronger Together partnership was about to remind many circles, especially as Raniyah was saying, on the eve of the presidential election, and then the whole painful, transition, and then go deeper on a new administration. But also, I remember, I'm sure everybody that was part of that effort, when someone was driving in a reservation and this person was through a phone call, participating, because the person was saying, we don't have those spaces when people of color come together. And she was doing a delivery from some PPE in one of the native reservations. And to us, we were very emotional when also we saw those faces, from Puerto Rico to California, from Illinois all the way to Louisiana, etc., Guam, Virgin Islands. And I told people, I said, we were so proud because Also, we were very crystal clear to be a conveners, you know, Lance, Raniyah, and yours truly to be a conveners. And it's very rare also, you know, because every guru of marketing will tell you, don't work with anybody. Your brand is the most important. But we saw beyond that, you know, we saw the impact, the public health crisis that is not new, the racial injustice, the health inequalities, and we said together we will be better.
Actually, that's a very good segment on to the next question, because that idea of coming together and rapid responses. Last year, we saw many people conducting assessments and research on COVID-19 very quickly. But this was a different kind of collaboration, and in the sense that it grew out of the community. What do you think is the role of these types of collaborations among people of color-led organizations in advancing health equity and racial justice in the midst of this unprecedented public health crisis generated by COVID-19?
I could start, and I apologize. You know, I will have to step off in a little bit, but and I'm sorry for that. But you know, one thing I want to share about our rapid assessment is that we also did qualitative surveys. We just know that for our communities, you know, we were doing surveys and we were contributing to surveys, right, left and right, as Raniyah and Guillermo were saying it. But we wanted to do it. Of course, we wanted to make sure it added value, but we wanted to dig deep in terms of what our fellow POC HIV organizations struggling with. We wanted to get at the core, and because we know that we need our fellow organizations to survive. We saw a decimation of organizations in the HIV movement over the years, and for POC-led organizations, and we just knew that we couldn't see that again. Our institutions are so critical to this pandemic, future pandemics, but especially we know, like Raniyah is saying, this will continue. It's not a one and done thing. This will continue. We will have to maintain momentum so that communities of color are not impacted over the long term. And so in our assessment, we really made sure that we were trying to dig deep and understand really root cause, like where are the pain points for organizations now and into the future? How can we make sure that we are really seeing that we are here to stay? We are here to make sure that we as a collective resource are the infrastructure for communities of color, and we really need to take care of the health of our organizations. And so the other thing I'll share is that, you know, when we saw on President Biden's first day in office, him signing an executive order about advancing racial equity and supporting underserved communities, that was just a sign of hope that we should be helping to define that. We as people of color, that organizations, that should be our number one priority in some ways, so that we can together push and advocate, use the platform that we developed collectively at our think tank and through the assessment, so that we could really make sure that we are front and center as we move forward around funding and resources and building our own infrastructures, and then collectively together building that momentum.
Yeah, I think it was also unique because oftentimes research about people of color is not led by people of color. And that was, you know, I think something that was really unique about how we approach this. And it also was not as if we were trying to only assess. So, you know, we do the work as well. And so it really was kind of, you know, one of the core principles of mobilization is people closest to the problem have the best solutions for those problems. And this research approach that we had was really like that, you know, that it was based off of our own experience as leaders of organizations, and that we had an approach in trying to understand more, because, you know, not because we got some big funding grant that was like, you know, we're, you know, NIH is looking at trying to research, you know, what is happening to community-based organizations led by people of color. It was about us. And so we had the idea. We said, we know we need the information. And we said, okay, then we'll figure out the money. It was really about, you know, it was initiated because of our own experiences. And we thought that we were the best people to be able to ask our people what was going on. Because like you said, at the time, there was a lot of assessments that were happening to try and figure out what was happening with the HIV workforce, and, you know, what's going to happen with our efforts to try and end the HIV epidemic now that we are in the middle of the COVID-19 pandemic. And is there going to be is there going to be an HIV infrastructure when COVID-19 is over? And what we saw as a huge gap was like, these are not people of color led institutions. They don't even have people of color on their boards. They don't have people of color on their staff. They aren't even asking sometimes about what the racial and gender makeup of the leadership and organizations were. And so I think that one of our successes was, you know, a for us and bias approach with research, which is not often the case. And I think that the folks that participated felt that. And it wasn't just like this research process where we asked the question and that was it. This was the beginning of a long-term strategy to really build sustainability for people of color-led infrastructure to respond to healthcare issues within our communities.
If you could speak a little bit about also the intersection of COVID-19 with other issues that were happening at the moment, like in terms of the racial justice, the language justice, the issues of economic disparities in the middle of it. That's something that was very clear. That it was not just about COVID-19, correct?
Well, you know, as you know, and we encourage people to read both reports, but the think tank especially, it was crystal clear that the economic impact on the whole nation and the whole world, actually, we quickly anticipate that will have a domino effect. But how 2021, 2020, 2021 will define us and will define the US and the territories to go deeper in pursuing racial justice. How important it is for us to understand that also poverty, how, you know, police brutality, how so many things impact your mental and emotional and health and well-being, you know, of our folks. And I always say to people, and Raniyah used a beautiful word that I always like to remind myself, is I have to be in permanent solidarity with my brothers and sisters. And that's across the board, you know. And people say to me, you know, why? And I say, because solidarity for us means to be active, to show how you care about somebody, about an organization, about a leader. And we need to, you know, honor ourselves, respect ourselves, support ourselves, but also challenge ourselves to respond better to the urgent needs of our communities that we serve.
Mm-hmm. And one of the urgent needs that seems to be very present now is the issue of vaccination, in terms of the disparities in vaccination, geographic disparities, racial and ethnic disparities. What's the role of the partnership to contribute to the uptake of vaccination in our communities?
I think there's a huge need and role for us to play in vaccinations. And I think there's multiple reasons why. One, I think that all of us have missions around ending HIV in our communities. We're not going to be able to end HIV unless we can also respond to COVID-19. And so vaccinations are a key pathway in helping us to get to a new normal that is not impacted so dramatically by COVID-19. I also think that vaccinations for our community are so important because the reasons why we don't see vaccinations, the reasons why our communities are not getting vaccinated at this point are the same reasons why they are disproportionately impacted by HIV. So it's because they don't trust medical institutions. It's because they don't have access. It's because there's healthcare issues. They don't have trusted providers that they believe or have relationships with when it comes to healthcare. And so I think that really the issues now when it comes to vaccination, right? We've seen a slowdown in vaccinations in most places across the country. And this idea that the people who want vaccines, who believed in vaccines have been able to get them at this point. And so people who haven't gotten them, there's bigger issues there. There's access issues. And I think responding to those structural issues is not just trying to make sure that people know how mRNA vaccines work. It is about these structural challenges, that are the reasons why 40 years into the HIV pandemic, we have these huge disparities that still persist. And why, though we have the biomedical tools that could theoretically end HIV, we're not ending HIV. And it's because of these structural issues. And so I think that in our efforts to respond to COVID from a structural place, really looking at access, you're also then responding to the structural issues that really are what continues to fuel HIV. And so I think that it is within our missions, it's within our charge, it's within the best interest of our communities to respond to why we don't have vaccination rates. But I think it's important that it's not, put on, we're not trying to place blame on individuals and just say, this is what you need to know about COVID, and let me put this in your arm, and, let's put in laws and policies so that we restrict opportunities and education and employment for people that are not vaccinated, but rather we go with a structural approach that responds to and dismantles why people feel concerned or don't have the access to get vaccination in the first place.
Yeah, and I would add on that, again, it's a bias for us approach. We know that too late in the HIV epidemic that it was about who the messengers are. It wasn't the medical providers, it was the community that needed to be the messengers, that needed to be armed with the knowledge and data and science so that we could inform our communities. And that is our number one approach. We know that there is still hesitancy, there is still issues around uptake, which I think, it's about access, and it's about information and education. And it's about who is delivering that information, how are communities receiving that, who is giving the information, and that's so critical around the results that we will see. I know I need to step off, but I just want to reiterate another point that both Raniyah and Guillermo have been saying is it really is about trust. We're talking about community trust, but it's the trust that the three of us have built together. I can't even tell you how that has gotten me personally through this past year. I couldn't have done it without having supports and having us checking in regularly. And we just know that goes such a long way. And we don't take trust for granted. We built that trust over years and years and years. We proved to each other that we could do more together and that we cared about each other. And this wasn't just the first time we had done it, but for for our new partners, this is what our message is that, we're in it for the long haul. This is not just a one and done thing. This is something we are so believing in relationships. We're so believing in building trust. And that is, we don't take that for granted. And I just want to thank Raniyah and Guillermo, and of course, Danielle, thank you for moderating, and I'm going to step off.
Thank you, Lance. No worries. Thank you so much. Be safe. I just want to add also the piece of trust. And I truly believe that people ask me, we advertise, but nobody show up. And I said to them, well, as a first strategy is critical, the mass vaccination centers, this and that. But if you want to go deeper, and those folks that have been marginalized, that have been pushed aside, that have been stigmatized, it's not just one strategy in terms of vaccination. It has to be a multi-pronged strategy. But in that multi-pronged strategy, you have to partner, city, county, state, and the federal government with trusted stakeholders, aka community-based organizations, community clinics, organizations that have been building a trust in their communities that they serve. Plus, we need to allow also to people to express their concerns. I always tell people, if somebody is debating about, we need to be patient enough to listen and validate their concerns, because our goal is, as Raniyah said, we want to try to eradicate viral hepatitis, especially hepatitis C. If we have a cure, we want to end HIV, because we have all the tools to truly advance and not allow anybody to develop AIDS in 2021. But we will not be able to do it with this global pandemic that paralyzed the world. And I told people, I say, and I agree with Raniyah also in terms of this thing is the new reality. I describe it to people, this is like 9/11, that sad day that changed, the world. And then we learn to adjust to the new realities, right? In terms of no water in the plane, this and that, extra security, et cetera, et cetera, et cetera, as a national security priority. Now, public health, hopefully, will be the priority for this nation. Because I always told people, I say the biggest punch that we got in the gut as a nation and as a planet is that we were not prepared. And some people will say, we don't need to be prepared. Well, look the results, in terms of the human cost. And it's not, an easy issue to deal, because it's complex, and we need to reset, reimagine how we engage, how we deliver services, but in a priority way, vaccination, because we know that is the finish line that we will reach, and then we will just rest for a little while and begin a second race. Because I told people, I say, it's a continuum, right? Life is a one-way ticket. We better remind ourselves that it's a one-way. I wish that could be a round trip, but it's not. And the other piece that I want to also rescue here is that when we talk about vaccination, we want to embrace a multi-pronged, culturally relevant, but sensitive engagement strategy to vaccinate as many people as we can. And I know that we're moving forward, but we're not there yet.
Yeah, something that I think some of the themes from this conversation that are emerging are one is the issue of the structural factors that were so key during the HIV epidemic, early part of the HIV epidemic, and it still are some of these structural factors that also increase COVID-19. And your organizations are so well positioned to learn from those times and to utilize those lessons learned to increase vaccination. What's next for the Stronger Together partnership?
I love that finger. Good. Well, Lance, Raniyah, and I, we are committed to continue evolving. We were paused because, as we know, the nation went into a new tenant in the White House. It was a priority for us to, position the three organizations, explore other partnerships, promote, in Castellanos and the team at Black AIDS Institute and at the San Francisco Health Center. All of us were together to make visible the reports and so on. Now we are getting ready to call for a national consultation with all those folks that attended the People of Color virtual think tank on May 27 from 1 to 2 Pacific time, 4 to 5 Eastern Standard Time. We will be calling for a check-in, 1 hour, powerful hour to check in with everybody about, the reading of the landscape in terms of the transition, and then discuss some key developments that I think we need to position in the context of 2021, half of the rest of 2021 and 2022, to explore some other projects, some other developments. We know that this new administration, we have a brand new Secretary of Health and Human Services. NIH continue to play a leading role on learning more about COVID, because don't forget that, people say to me, how can they develop the vaccine? I say, well, they took a lot of the last 35 years or 30 years on vaccine development, thinking about HIV and other illnesses that were developed. And I remind people, I say the importance about us in the immediate future is also to assess where we are as a workforce. The HIV, hepatitis, or the infectious disease workforce, I would say from the community side, have a lot to say in terms of how can we continue to contribute to advance and responding to all these health challenges. But we need to also pause and assess, because Raniyah in her remarks at the beginning was, we do not only pause and ask about the infrastructural impact, right? Moving from working from a particular location to be virtual. And not everybody did that, because Lance always remind us, and also Raniyah have a direct, interaction with people that they serve, our direct services as well, to adjust to deal with in the middle of this terrible COVID-19 pandemic. But we need to assess and go deeper to see what we need as a workforce, because this is the time, the 2021, 2022, to adjust for the next, to be prepared for what is coming later, but also, begin to think in a 5-10 years cycles, because they take time also to adjust organizations, institutions, because we need to protect them too. And one of the issues that we want to elevate is the urgency to seek more support for internal infrastructure development and consolidation. And again, I always remind people, and infrastructure is important, equipment, this and that, but also, professional development, strong fiscal controls, a strong human resources management, et cetera, et cetera, et cetera. All those internal pieces that sometimes, especially people of color-led organizations, do not receive those fundings or those resources to protect the organizations. Again, it's very easy to bring down an organization. It's very hard to establish, to build, develop, and more important, to sustain it for the long run. Am I missing something, Raniyah?
No, I think you got all of it. I knew that you were going to have like the date and time of when we're connecting again. I think the only thing that I would add is, with this new administration, they owe being in the White House to people of color. And it's such a unique time, especially from where we've been for the past 4 years. And so I think for us, we're excited because we believe that this administration is interested and open to making sure that people of color-led organizations and communities of color overall are supported. They're interested, they want to achieve racial equity, health justice. And I think that for us as a collective of people of color leaders, that we are very committed to making sure that we get investments in us. There's been so much work, I think, in trying to make sure that people who do healthcare work are culturally competent and culturally relevant, which I think is great. But there has to be the same, if not more, investment in ensuring that people of color leaders are successful in our work. And I think that, you know, what's next for the partnership is really making sure that that investment from this current administration, from the federal government, shows up in that way. That we are the folks, we are the communities that got them to the White House, and that we get what is owed to us, and that we achieve equity in a way that supports our infrastructure, that supports us as leaders, and supports communities having the resources to support themselves. And so I think we're in a really good place to do that. We didn't know what was going to happen when we came together as a partnership, but we're excited that I think we have an opportunity to really kind of get to the end of HIV and doing it. And the only way I think that we can do that, and I think probably as a collective we can agree that would happen, is if we do that for our own communities. And I think there's real opportunity to do that now.
I have a question related to racial and ethnic equity, and as you were talking about the small organizations and the larger organizations and geographic disparities and the composition of the boards and in different organizations, does it seem to you that some of the structural issues driving health inequity are also driving infrastructure inequity?
Yeah, no, that's, you know, and again, we sat every time Lens and Rani and I talk about that, and I always add micro, small, medium, and large community-based organizations, because there are some tiny but mighty organizations that are not in a lot of people's radars. And the infrastructure is again, you know, if you don't put a good foundation at the beginning, especially when someone is starting something, a very unique strategy to engage X, Y, and Z community, we need to make sure, and for that reason, Lance, Raniyah, and I, we always talk about that we need to pay attention right now, obviously at the federal level, that's a priority, but also we broadcast how equally important and sometimes even more critical at the federal level for some folks is the city, the county, and the state. And that engagement, we always remind folks, it has to be adapted and tailored to wherever you are. Because, you know, if you're in Mississippi, you know, if you're in Louisiana, you know, Tennessee, Georgia, you have different rules of engagements. But I told people, I say, you know, it's across the board, and also Puerto Rico, U.S. Virgin Islands, and DC as a focal point for us. And we believe that sometimes when we come together and we are able to share some tools, some strategies, or pick somebody's brain, usually 99% of the time, you come up with a very good strategy. But coming back to your question, Castellanos, is infrastructure is, I think, the big issue, you know, and I agree with Raniyah, we need to remind the current administration that we are grateful that the Biden and Harris administration is doing a lot. And I think right now they have a good sense of trying to be an administration that says something and do something, and that's a good thing. Our job is to make sure that whatever they're doing is from the lens of racial justice, ethnic justice, and equity, because otherwise, you know, we will not be part of the picture. And I told people, if you're not there, you're not in the table, you become a menu. And that's a problem for us.
Yeah, I mean, I think that the lack of infrastructure in many people of color-led organizations is absolutely connected to racial equity. There was a survey done last year that looked at nonprofits and who gets the most funding, and it is overwhelmingly white-led organizations. I mean, I think that you can just kind of do a look around of the HIV organizations across the country, and it is overwhelmingly, the larger the organization, they're usually led by white individuals. And then we aren't even talking about trans-led organizations and, people living with HIV-led organizations. And so there surely is an equity there that fall along the same lines of income, race, where you grew up, education levels, and systemic racism is all about these things are intertwined. You can, as an individual, be a do-gooder, right, and believe in racial equity, but there are unearned privileges that most of us have, and they show up in the resources that we have for our organizations, and I think that until we can truly respond to that, we are continuing to kind of like run a race with like one leg tied and like a blindfold over our eye, because we're not being transparent, about how we get, who's giving us money and who's not getting money, and who's able to hire development people to raise the money, or, being able to pull in somebody who knows how to do finances and ensure there are strong measures in place there. And so I think or having monitoring and evaluation, I mean, there's so many things that we know are critical for organizational health that many people of color-led organizations don't have, not because we don't think it's important, but because we don't have the resources for it.
Absolutely. So we are getting closer to the end of our discussion, but I have a question from someone in the audience. And we talk about trusted sources of information. So the question is, what do we tell our communities who are afraid or fearful of getting vaccinated?
What we tell people is to figure out who you trust information from and to make a plan. Who do you trust? And figuring out those trusted sources of information. Is it your doctor? Is it is there an internet site that you trust? Is it family members or friends that you trust? And then to figure out what your plan is. Maybe, so I'll give my father, for example, that he wants to wait 6 months to see what happens to everybody who's gotten vaccinated. And I say, okay, Daddy, I get that. That's your plan. So let's talk about the PPE that you're going to use. What are the safety measures you're going to have in place to make sure that you're taking care of yourself, so that you aren't, getting COVID. Some people are like, I'm never going to get the vaccine. Okay, so you're never going to get the vaccine, and let's figure out what are the reasons why you're never going to get the vaccine, so that you have those key points of information, so that if you say you're never going to get the vaccine for XYZ reason, if XYZ doesn't happen, what changes for you, right? But also, if you're never going to get the vaccine, then what are the precautions that you should take? And so I think it really is a harm reductionist approach, that we shouldn't be shaming people if they feel like they don't want to get the vaccine. That really, for people who don't want it, especially if you're a person of color, affirming the feelings that they have, maybe they don't trust the government, maybe they don't trust the speediness of the process, maybe there's something innate that they feel like doesn't make sense and they feel like this is natural. Okay, I understand that's why you feel this way. What can we do to make sure that you stay protected if the vaccine is not going to be an option for you? And so I think that it's really about making sure that people are informed, making sure that they have a plan in place, so that they can protect themselves. And I think that when people are informed and they have informed consent, then they are able to make the autonomous decisions around their own health. And so if they make a change in their mind in 3 months, they have the resources, the information, and the skills to make that change on their own. own. And I think that with time, if we can train people, give them information to figure out what informed consent is, to make sure that they are able to be their own health advocate, that as more data comes out, as we see more safety measures, or safety data, that we'll continue to see an increase. But you can't, if you dismiss them, then that's going to be it, right? We've lost the opportunity to really make sure that individuals in our community can be their own best health advocate.
I agree with Raniyah, everything that she just said. I will only add that it's okay to have fear, and I think, validation about where you are is important, because I always have issues when people are rejected, and I again, when you begin to have a conversation, I was talking with somebody and the person say, I don't want to get the vaccine because I saw on WhatsApp that a month later you get almost blind, and then go with the issue of Raniyah was saying, okay, if you have fear, who you can ask, to learn more, not to condemn, not to judge, not to be judgmental, right? But also, to allow people from the harm reduction and also from the stages of change. That is very important, to validate people and move people, hopefully, from one place to another, to have patience from us for people to reach their own conclusion and say, okay, I see the benefits now, and can you help me to get vaccinated? I say, of course, here's 3 options to do it, to make it happen.
And thank you for the answers, because those answers actually mirror our early conversation about the trust in the medical system, the need to understand deeper our own communities, and the similarities that of beliefs in some of our communities, and some of the same similar challenges. So what it seems to be like a personal decision sometimes is bigger than a personal decision, and that's so very important. Any final remarks that you would like to make?
My final remarks is that we're stronger together. I think that's, the best thing that we can say is that we're stronger together. And I think that's the way that we're going to achieve our missions and get to the end of HIV and to the end of other health inequities, is doing it together.
Agree with that. I will only encourage folks at the local level or at many levels to build partnerships. It's unbelievable when I always told people, a long time ago, I was part of the New York State PPG, and I worked with leaders of 2 reservations in New York State. And I learned so much from the native approach. And now working for a little while also with trans-led organizations in New York City, I learned so much. And I always told people, I say, the beauty about coming together is because you become stronger, but also you go a little deeper on the implications to have a leadership role wherever you are in your organization, and also allow us together to build something unique, and that's something that I take very deep. I love, respect, and admire Raniyah. Lance is my twin brother, and Raniyah is also my twin sister. And together is the best. Stronger together is the best way to go.
So we commend the leaders of these and other community collectives. I was going to use partnership, but I like the word collective, as it was mentioned before, for their commitment to joining forces together to improve the lives of our communities. And it's clear that these efforts can and will play a role in shaping our public, social, and economic policies in the future. And this is particularly important as we continue addressing the long-term health disparities and social and economic vulnerabilities in the communities of color. That's all for now. We kindly ask you to complete the day 2 of the online evaluation. The link is being placed in the chat. Thank you, Guillermo. Thank you, Raniyah. Thanks, and have a wonderful day.
Bye-bye.